When you're delivering the NTI, you want to be certain that the patient is lying back. Since they're going to be wearing this at night, that's the position they're going to be in anyway. So one of the first things we want to make sure of is that you're inserting this on the correct arch. Sometimes people forget what arch they submit to the lab to. So in her instance, it's a lower NTI. A little bit of a snap there, so I know retention is probably pretty good. One of the first things I want to make sure of is that the NTI is retentive enough that the patient cannot dislodge this in their sleep. So go ahead and try to remove the NTI with your tongue or your lips. If you have to make some silly faces, that's fine too. Just try to see if you can get it out. You can't get it out? No. That's great. Go ahead and take your hands and try to get it out that way. Great. Now, how did it feel? Was it too tight or?
No.
No. If by chance it's too tight, there are ways that we can refine the inside of the device, and we can go over that in another segment. It's critical that you send accurate impressions because that's going to give the lab technician the perfect data that they need to make sure this device is retentive so you don't have to do as much tear side adjustments. The next thing I check for is I want to make sure that the NTI is centered over the opposing central incisors. In this case, it's 8 and 9 since it's a lower NTI. Go ahead and tap your teeth together. Great. How does that feel? Does it feel like you're hitting one tooth more than the other?
Even.
It feels pretty even? Mm-hmm. Great. Something that I want to mention is patients might have a midline that's off. So when you look at your NTI, the discluding element might seem a little off-center, but as long as when it's snapped in, it's hitting the opposing centrals evenly, it's perfect and it's going to do its job. The next thing I want to check for is I want to make sure that the patient has complete clearance of canines and all posterior teeth. Go ahead and tap, tap, tap in your regular bite. Perfect. Now go ahead and move your jaw as far as you can to the right-hand side. Great. And I'm making sure that there's no canines or posterior teeth touching whatsoever. And now move as far as you can to the left side in both right and left lateral excursives. The right side looks great. Go ahead and go to your regular bite again. Tap, tap, tap. Good. Go ahead and turn to the right for me. Turn this way. Great. Go ahead, tap, 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 and move your jaw as far as you can to the left side. Clearance there, and then move to the right side. Great. Clearance there. Great. Tap, tap, tap again. Make sure you're in your regular bite. Go ahead and put your jaw in your regular bite position and have your jaw relax. There you go. If by chance we had a canine that was touching the acrylic, we could do one of two things. One, you can increase the vertical of the NTI device, but you have to be very careful when you do that. When you increase the vertical, then you could cause excess pressure when the patient translates, and we'll go over that a little bit later of an NTI that's too open. You don't want that. What is the easiest thing to do is if the canine has a really sharp tip, you can do a really simple enamelplasty and smooth off the edge of the canine so that it just has just enough clearance. It's not touching anything. Same thing with the posterior teeth. If you just have one of the cusps just barely touching opposing cusp, just smooth it off and you'll get your clearance. Now I'm going to check protrusive movements here. Go ahead and let your jaw go as far back as it can towards your spine. That's our retrusive. And then as far as you can out, away from your spine. Great. The other thing I always check for is you want to make sure that the angle of the discluding element is such that as the patient is going into a protrusive motion, that they are not increasing their vertical dimension too much. That can cause some significant discomfort. This is one of the most overlooked steps in NTI delivery. And one of the steps that I overlooked a lot in the beginning was watching the patient go into a protrusive and making sure that the distance between the molars is the same when they're in their centric position as when they're in their protrusive. So let's check that out. So I'm looking at the space between the molars, and I want to make sure that in her centric position, go ahead and tap a few times, make sure you're back there. Go ahead and move as far forward as you can, as far as you can go out. Great. I want that distance to stay the same. If you start to see the distance between the molars drastically increase as the patient goes into a protrusive, the angle of your discluding element is too steep and it needs to be adjusted. Go ahead and tap, tap, tap. Great. Well, we've covered the 5 basic steps that it takes to deliver an NTI, so it's as effective as it can be for you and your patient.